Good morning, everyone. My name is Doris Rodriguez, and we'll get started in just a few minutes where we give people a moment to get situated. So if you need to get anything, please do so now. We'll start in a couple of minutes. I also want to let you know that we'll be announcing this presentation. Sorry, we'll be having closed captioning available during this presentation. And now I will connect to Facebook if you can just give me a few seconds to do so. All right. Before we begin, I want to let you know that we'll be broadcasting today's event live via our Facebook page, and I want to give a warm welcome to those joining us there. As I mentioned, my name is Doris Rodriguez, and I'm the Autism Initiative Coordinator here at Sinergia's Metropolitan Parent Center. I want to thank you all for joining us today. We are glad that you chose to be here with us. Before we get into it, I would like to introduce our co-presenters today, Joanna Santana, Director of Family Support Services at Sinergia, and Mariam Chartwell, Housing Advocate and Program Coordinator at Sinergia. So glad you can join us today. If you're joining us via Facebook Live, if you have questions, please place them in the comments section. So let's begin. A few housekeeping notes. Everyone who registered via Zoom will receive a copy of the presentation via slide in a follow-up email. A survey will be shared in the chat and via QR code at the end of the presentation. We will have time at the end of the presentation for Q&A, and we encourage questions at any time. However, please remember this is a public forum and we're being broadcasted on Facebook. No simultaneous translation will be offered at this moment. A presentation in Spanish will be scheduled in the future. Who is Sinergia? We're a non-for-profit community-based multi-service organization founded in 1977. Our mission is to enhance the well-being of individuals diagnosed with developmental disability as well as their families. Sinergia offers Medicaid waiver services for those who qualify in the Metropolitan Parent Center, and it's an autism initiative to provide services to families of children and youth ages 0 to 26 of who has a diagnosis of our or are suspected to have an intellectual or developmental disability. The Metropolitan Parent Center is one of the 3 federal-funded parent training and information centers in New York City, offering training designed to develop the advocacy skills of parents while educating and empowering them to support their loved ones or themselves. The Metropolitan Parent Center offers parent training and webinars, one-to-one intensive technical assistance to parents and legal guardians, one-to-one consultation for informational referrals. Services are at no cost to families and individuals, and the Autism Initiative Project, which we'll go into detail in one of the following slides. The parent centers. I will also like to share information about our partners in addition to Sinergia. These include the 3 New York Region 1 Parent Training and Information Centers collaboratives, which are federally funded. The organizations are Advocates for Children, Include NYC, and the Long Island Advocacy Center. Their services are provided at no cost to you. The Autism Initiative. The Autism Initiative project supports the work of the Metropolitan Parent Center, funded by a grant from the New York City Council under its Autism Initiative. The project is funded by a grant from the New York City Council under its initiative and was funded for fiscal year 2025 to 2026. Since 2007, this initiative has linked families to other services and supports that meet the individual needs of their children. I want to highlight the programs served under these projects: workshops and webinars in English and Spanish related to autism, integrated transition program for teens in collaboration with the Museum of Modern Art, virtual after-school art program for children ages 3 to 13 and their siblings of similar age, bi-monthly support groups for Spanish-speaking parents, including evenings from 7 to 9 p.m., recreational activities when schools are closed. Who do we serve? We primarily serve families of children with disabilities in New York City by providing support, training, and information to assist them in navigating the special education system and advocating for their children's needs. Our goal is to empower families to become effective advocates for their children. This includes parents and legal guardians of children of all ages and all types of developmental intellectual disabilities. In addition, with our integrated transition program, offering transition services for autistic youth and young adults, we provide a variety of direct services for children and youth with disabilities, families, professionals, and other organizations that support them. Parent training. The Apple Academy is a set of advocacy activities and trainings over several classes designed to increase the capacity of the family, caregivers, and people with intellectual and developmental disabilities to become advocacy leaders and engage in civic activities. The Apple Academy covers several topics like your rights under IDEA, disability history, understanding the IEP, transition between pre-K, KIP, turning 5, and adulthood, and due process. Workshops. We offer in-person, virtual, and hybrid workshops to parents and professionals that want to learn more about special education, including early intervention, Committee of Preschool Special Education, Committee of Special Education, transition to adulthood, monolingual workshops, host organization and host is responsible for interpretation in other languages. The Autism Initiative workshops, we partner with community-based organizations to coordinate and deliver quality workshops. Webinar requirements. Workshops are about 60 to 30 minutes per presentation with 15 to 30 minutes of facilitated Q&A. Schedule, Monday through Friday from 9 a.m. to 5 p.m. for remote and in-person. In-person, night and weekend events on a case-by-case basis. Monolingual workshops. 10 to 12 parent guardians to attend each workshop for a minimum of 10 parents. 10 to 14 days prior, we will send a reconfirmation email to ensure all the details have remained the same. 2 days prior, we will send a final confirmation email to the point of the contact. A copy of the slide deck will be shared with attendees. Special education advocacy. Our bilingual English-Spanish education specialist provides intensive and individualized technical assistance to parents or legal guardians of students with disabilities who are navigating the early intervention or special education system. Services may include consultation with special education specialists, attendance at IEP and school meetings if needed. If necessary, legal advocacy referrals to outside legal services may be provided. The Integrated Transition Program is a socialization hybrid program for teens who have a main diagnosis of autism. The program is facilitated by a bilingual English-Spanish BCBA professional, and there's 22 sessions in total. To emphasize the development of independent life skills, including self-advocacy, independent living, communication skills, and strategic for fostering positive relationships. Case management is offered to participant families, and in-person sessions require parents' participation. Youth should be between the ages of 14 and 21, able to communicate in English, attend the group community in person Saturday sessions, be able to be in a group setting with facilitators and teacher support, with no more than 3 absences. The ART program. The after-school art program provides children with autism spectrum disorder, ages 3 to 13, with opportunities to develop social skills through various activities. The program encourages parents' involvement to help families learn the skills being taught and support their reinforcement at home and within the community. Students will engage with different visual art forms in an interactive small setting. Siblings of similar ages are welcome to participate. The support group is open to caregivers and persons with a developmental disability. Moving on. As mentioned, those who are living at home with their families attending a residential school or if they are in an adoptive home. This session is offered on the second Wednesday of each month in person for parents of children ages 0 to 13. The session of the last Thursday of each month is virtual, held in the evening for parents teens ages 14 and older. To register, please contact the intake line at 212-643-2840 at extension 602. Now, I will hand it over to my co-presenter, Joanna, who will introduce the Family Support Services at Sinergia. Thank you.
Good morning, everybody. Thank you so much for joining us, and thank you so much for your interest in learning what services are out there for your loved ones or for those that you know within your family or community that have been diagnosed with a developmental disability or intellectual disability. Here at Sinergia, we have a program called Family Support Services. It consists of a contract under OPWDD, funded by OPWDD, which is the Office of People with Developmental Disability. And within that contract, we are able to serve through 5 different avenues. We have the non-Medicaid case management, where we support the families with OPWDD eligibility and other things that I will explain more further. We also provide evaluations for Manhattan residents that has private insurance. We also provide family reimbursement program, allowing the families to request reimbursement up to $3,000 every fiscal year. We also have educational advocacy for Manhattan residents only, as well as housing advocacy, and we will be definitely delighted to present you more about each of these programs, as we understand OPWDD services in the life of our loved ones are very important. I love to share with the families that OPWDD offers services that allow family members to be independent in the community. Many parents confuse or are not sure if the services that they receive at the school are the same from OPWDD. And it is always good to know that they're not. While you have the Department of Education providing you with appropriate education for your child and related services through an IEP, an individualized educational plan, OPWDD helps you with services in the community and at home with the goal of assisting or helping your loved one to become more independent in the community. Could you please follow with the next slide? I'm going to go through each program a little deeper. So the first step, knowing if we qualify for OPWDD or if OPWDD is something that we could benefit from as a family, especially the person that lives with us with a developmental disability, is through service coordination. You need to first understand that there must be a suspicion from a doctor, from a clinician, that there is a developmental disability or something is hindering the person from developing fully. And this will open the door for evaluations, for inquiring if the person meets the criteria for OPWDD and if which services will be good or necessary for the development of that person. Here at Service Coordination, we support families with no Medicaid or private insurance through these initial steps. We help the family to get evaluations. If the family doesn't have Medicaid, that's okay. There are programs that are fully funded by OPWDD for families with private insurance. And some of these programs even come to the house to conduct the evaluation. So they are very helpful. Once you have the evaluation in place, the next step is to apply for OPWDD. And once you receive a determination of eligibility, in the case that is a positive, then you get connected with a care coordination organization. There are 3 care coordination organizations in New York City, and they are Tri-County, Care Design, and Advanced Care Alliance. And their purpose is to connect the people with the services that they need. And they identify the services through what they call a life plan. It's a plan that will describe the person, the needs, their routines, and what services are in need or needs to be incorporated for a more independent life. Now, here, service coordination, we do have the limitation at Sinergia for families with Medicaid. A couple of years ago, agencies, providers like us were able to submit applications to OPWDD, but that is no longer the case. And it's important that families understand this so they will not have expectations that doesn't match with the reality. If you have Medicaid or if your loved one has Medicaid, the fastest way or the more direct route to OPWDD services is to go to a clinic, get the evaluations, and once you get the reports, you connect with the CCOs or the care coordination organizations. There is no need of middlemen if you have Medicaid because you have the most important, which is the mean of payment. Once you get the evaluations report, you can go to the CCOs and say, I want to apply for OPWDD, and it's the best route. We can always provide information and referrals to families that are seeking for a little more guidance. It would be our pleasure. And definitely connect the families with the services. Next one, please. Our evaluation program, as I said before, is only for Manhattan residents. These criteria, unfortunately, only limit our services to families that are living in Manhattan, and we need to bound to them because it's contract requirement. We're also bound to serve non-Medicaid participants for the reason that if you have a Medicaid, it's more easy, it's more accessible to you to get evaluations than for people with private insurance. These evaluations used to be very pricey, very difficult to obtain, and this program provides this facility to families with private insurance, understanding that the need of their child is the priority theme in the equation. What evaluations do we provide? We provide psychological evaluation, we provide psychosocial evaluation, comprehensive autism assessment, adaptive assessments, among others. And I can explain a little bit each of them for you to understand why they are a requirement for OPWDD. The first one is the psychological evaluation. It is necessary to know the level of IQ or the cognitive level of the person if you want to apply for OPWDD. It needs to be established that the person has certain level of intellectual disability, and this will affect the person's daily living skills, integration to the community, or even holding a job in the future. These levels, according to OPWDD, are under 70, and it cannot go above that unless there is an autism assessment that prove what are the areas of needs that this person has. So again, a psychological evaluation must have an assessment of the level of intelligence or IQ. Besides that, the psychological evaluation must have an adaptive assessment. And this assessment is an assessment that indicates or proves what is the level of support that this person has or needs. How much support this person needs to accomplish or to do things that we in our daily life accomplish without even noticing. This is really what determines how independent is the person. And it's usually based on the family interview. That is why we explain to families, please be mindful of how you describe your child, not necessarily in the best of the best days, but how many times you need to tell your child to tie their shoes, or to go and brush their teeth, or to get dressed, or even daily activities like eating, or like picking up the room, or be careful crossing the street. How many times you need to provide prompts will let you know how independent is your child, or your loved one. So this level is important because it goes in alignment with OPWDD's mission and vision, which is helping the person to be more independent in the community and in the house. And these levels are determining, or they will help to determine eligibility for OPWDD. Now, along with those two assessments under the psychological evaluation, OPWDD also requires a psychosocial, or a social history, as we know by the schools. It's just a report that provides an overview of the support system of the person, family members, who's in the life of this person, what is the routine that the person follows, what are the areas of strength, the areas of the need to grow in, and any other information that will provide like a social map of the person. It is very important that if your child or your loved one has autism, to obtain a comprehensive autism assessment. Why we recommend this for applying for a PWDD? Because if your child is, let's say, like one of my own child, that is very intelligent, very bright in topics that might not be 100% related to the every life situations, it could trigger a very high level of IQ and be confused by someone that is very smart or brilliant and doesn't need services because it's very smart. However, if we provide a comprehensive autism assessment, we will show where in the spectrum is our loved one. What are specifically the needs that our loved ones have, and what are the areas that require support? Usually social emotional, the need for being in a community, the need of enhancing the communication, the need of creating meaningful relationships. There are many needs that our kids with autism might display that might not be reflected in a psychosocial or a psychological evaluation per se. There are two evaluations that are conducted for the autism evaluation, and it could be the CARS, which we know is more like a checklist. If the person meets most of the criteria of the diagnosis of autism. But for this evaluation, we highly recommend the assessment called ADOS, ADOS, second edition, because it will break down, even by group age, what are really the characteristics of this child and what makes this person who they are within the spectrum. There is also another interview called ADR that is provided to the families, and these elements together will show a very clear or a more clear picture of how this autism is affecting the loved one. And we say among others because sometimes the eligibility committee will request specific assessments, and thankfully we're able to provide those assessments for the eligibility purpose. The next one, please. Now for this one, we get a lot of excitement because it is a service that provides a family up to $3,000 per fiscal year, meaning from July 1st to June 30 of the following year. And this funds are available for the families that can prove that their kids are using services or requiring items that the families need to pay out of pocket and that are connected to the condition. For example, we receive a lot of clothing reimbursement requests, and they are based on some of the behaviors that our kids have. Let's say pica, or let's say their child tear their clothes, or pull, or shoe, or is sensitive to the to whatever the clothes might have related to sensory issues. So it depends of the characteristics or the symptoms the person might have. This connection, the person needs more clothes because of this, will open the door for family reimbursement. This program has gone through changes through the last 2-3 years. Some families might find it more difficult to apply for family reimbursement, but if you have the proper guidance and the right elements that are part of the requirements, you will find that you can request reimbursement and in an ongoing basis. So just please inform yourself that a good application will have the form that is provided by OPWDD. You can find it in the website. It will contain a doctor's note, which could be filled by or created by the general doctor or a practitioner nurse or a therapist. And this letter mostly will describe what is the diagnosis of the person, what are the symptoms, and how these goods, items, or services will benefit the person, or what is the need of these items and services in relationship to the condition. If the person has a care coordinator, our personal recommendation is that this justification letter must be added to the life plan because it's clinical information that will expand, that will describe better the needs of the person. And the life plan must also have the service provider agency and the service under the Section 5. And along with those three elements, the receipts, which must be dated within the fiscal year that the person is applying for. So with those little guidance and family practicing, you will find that this service is accessible. Just need to be on top of the dates. Make sure that the wording is appropriate and describe the needs, and that you are following the guidance of the agency provider, in this case, us. Thank you. Following slide, please. And we have finally family support educational advocacy. Before I start opening the door to our colleague Mariam Chardiwa for housing advocacy. This program, Family Support Educational Advocacy, is a service or a support to families with OPWDD eligibility that are in need of support, guidance, even a demonstration or information or referral on how to proceed with school issues, with bus issues, or with IEPs, or not receiving the necessary services as described in the IEP. The purpose of this program is really to educate, to help families to become better advocates for their children, in which they will be able to not just request the services that their kids need, but also be on guard that these services are being provided according to this legal document, which is the IEP. So for that, we have educational advocacy specialists, our special education specialists that will provide guidance, that will provide support, and that will provide the families that route that they need to resolve their issues the best way possible. With that, I will pass it on to my colleague Maria Chardiwal to present the last family support services program, which is housing advocacy. Maria?
Hi, everyone. Thank you for that welcoming. Can everyone hear and see? Okay, awesome. So Sinergia's housing advocacy program is funded by two New York State contracts, one through OPWDD, which we're all here very familiar with or getting acquainted with. Our services for OPWDD extend to folks within all boroughs of New York City. So the requirement for eligibility for this program is that as long as one person in the household is OPWDD eligible, they are able to do an intake with us and receive services. And essentially what we do is we troubleshoot housing issues, and I'll go into the types of services that we provide. But before that, I want to dive into our second contract. So regardless of OPWDD eligibility, our second contract allows us to do case management for folks that live in Harlem, which is our home base in a sense, because that's where our physical office is. As long as you're a resident between 98th Street to 126th Street, we're able to provide this service, the housing advocacy service. And next slide, please. So the types of assistance that we provide, we've broken it down into different categories. It's application support, which extends to the Housing Connect Lottery, the very famous Housing Connect Lottery that folks have probably applied for at one point in the last few years, as well as NYCHA, the New York City Public Housing Authority applications. That's essentially purely income-based housing. Navigating re-rental applications for properties that are subsidized. So essentially, other than these two different forms of affordable or income-based housing I've provided, subsidized properties have existed probably before the Housing Connect Lottery and NYCHA. I say that because there's properties out here in New York City, but also throughout the country that have 8 units or 6 units or more, and they receive a low-income housing tax credit. So essentially that means that a few of their units, a certain percentage of their units can be income-based. Okay, so we help navigate that. It's a bit complicated, but not so much once you meet with us and you see the data that's out there. Then next is we love to refer to our community partners. So for instance, I have referral for free financial counseling. So we like to do that with Arriva. Arriva is another nonprofit. We've done, clinics with them where we've hosted them here at our home base office in Harlem so that folks can get that free one-on-one financial counseling assistance. And that pretty much also goes hand in hand with doing Housing Connect or any other kind of rental application because it helps prepare you for moving potentially, right? Or for saving and reaching those financial goals that do come in hand with, right, applying for a property. We provide technical assistance with NYCHA, annual recertifications, interim recertifications, and requesting reasonable accommodations. I mentioned NYCHA here because they do have a website with a self-service portal where one can log in. Some tenants out there may also be able to request a reasonable accommodation with their property manager or with their management agency. So we're obviously open to that as well. Housing Connect eligibility verification we assist with, as well as the rejection and appeal steps and final steps. It can be a lot of documentation that they request. Some folks have, for instance, a status that hasn't changed over 6 months and they want to know, hey, what can I do to just check in on the status? So we help coach you through that process on what to potentially expect, but also how to act fast so that if you are selected for one of the lotteries, that you're able to respond in a timely manner and also have everything ready so that you could be considered for that opportunity. The third item here we have is the DREE and SCREE rent freeze program. So there are two forms of rent freeze programs provided by the New York City Department of Finance. And one is referred to as the disability rent increase exemption, and the second is the senior citizen rent increase exemption. Now, the requirements for both of these forms of the rent freeze requires that the person who is the head of household or the tenant of record be the one on the application. So that means the person that's signing the lease and has a disability is able to apply for the rent freeze program, right? As well as the person who's a senior has to sign the lease in order to show that they are, financially and legally tied to the apartment, therefore they can receive this benefit. And we help navigate the documents, the application. So no worries on that, guys. Next slide, please. Okay,
I believe
so these
Joanna
are,
jumps into this one.
got you.
Thank you.
We had some more stuff. So I'm just going to quickly chime in and just add in a few more things, because that's not always there. So it's housing court support. That's one other one. So if you're a tenant that is facing an eviction, you have a non-payment, and you've received a notice from your landlord or something from an attorney, from the landlord's attorney that says, you are subject to owing rent, what's called a predicate notice or a 14-day or 30-day notice. It all looks very different for every situation, but essentially the process is the same. We encourage folks to not self-evict and to, basically read the documentation, and we help navigate this type of situation. That predicate notice is usually a notice to begin a housing court proceeding. So that brings a lot of ease in a lot of cases for tenants that aren't aware or that haven't been through that process before. So not only do we help review the documents so that you know what to expect, we also do provide hands-on support going to housing court if necessary, connecting you with legal aid agencies, because there's not just one, there's pretty much a handful of legal aid agencies that are in housing court supporting tenants. We also help with filling out one-shot deal applications. So if you have rent arrears and you're not getting evicted, but you do have this non-payment case and it could potentially result in an eviction, you want to know that there's that safety net, right? So the HRA one-shot deal provides that safety net. So we help with the technical assistance with those applications. And I'm just trying to think of anything else that we do, but basically anything related to being a tenant, having a challenge, advocating for repairs, if the apartment is in disrepair, if there's certain hazards in there that you've attempted to address and haven't been able to see any success with that, that's also a place for us to intervene as housing advocates and support tenants. And finally, we do workshops that are virtual, so they're webinars. We also, do in person. But for those of you who have attended, very happy. It's always been a great environment to connect with tenants on our work during our workshops, where we discuss, specific topics in depth. So we talk about how to address housing court. We talk about how to address a non-payment, but we also talk about source of income discrimination. And we collaborate with our community partners so that we can also share other services that are out there and accessible. And that is all for me. So thank you very much.
Next slide, please. So other services that we offer here at Sinergia are community habilitation. Community habilitation is a service that is approved by OPWDD once you get eligibility. And the purpose of this service is to help the person to become, to be safe in the community, is the best way to say it. How to navigate their community in a safety way. How to go to the store, for instance, and buy something, request a change. How to travel from one destination to another one. How to cross safely the street. These are things and skills and actions that we might do in a way that we don't even know or realize how many little steps are involved, how many awareness they require, or how many practice it might take to a person with an intellectual or developmental disability. So community habilitation is a service that will assign a community habilitation worker to the person and practice these skills of the daily living in the community or at home, right? We also have day services. We have a program here that if you go to our website, you will see the requirements, you will see if your loved one qualifies for these services. It's for participants with the intellectual developmental disability that are no longer in the school and are adults that might look for employment services, that might look for opportunities to volunteer in the community, etc. We also have family care, which is a type of residential service. The only difference between them is that the residential services are in specific apartments or locations from the organization, and family care involves providers and families that wants to adopt, if you will, this person with disability and wants to provide a more family-friendly environment. These services are also available here at Sinergia, and you can always request for information when you go to our website and write in the section of contact us. And finally, we also provide respite. Respite is a service that is very needed for families requesting support. It's a service that provides, just like the name says, a respite while taking care of the loved one. The caregiver can become tired, can become weary, and most of the time can even neglect their own needs because of the constant demand of serving the person with a disability. So respite services will provide that respite to the person, to the mother or to the father or to the family member or the guardian that is in charge of taking care of this person. So it won't affect the health in the long run and could be there for a longer time for the loved one. So I encourage you to go into our website and explore these services and other services that we offer here at Sinergia, how to apply, what do you need to qualify, and how you can start, right? What will be the first step? And with that, I will pass it on to Doris once again to continue with our webinar.
Alrighty, thank you, Mariam and Joanna. I appreciate it. So as mentioned earlier, we will now open the floor for Q&A with our presenters. So please make sure to write all your questions in the Q&A or on the chat. All right, so I know that we have one question from, okay. So first question, how do you get a case coordinator? I believe this one is for you, Joanna.
Yes. So case coordinator are available depending on your situation with the Medicaid. Let me say it this way. If you have a private insurance, if your loved one has a private insurance, doesn't have Medicaid coverage, we can provide non-Medicaid case management to help the family to go through those steps of evaluation, eligibility application, and finally connecting with a CCO. If you have a Medicaid or your loved one has Medicaid, the best way to approach OPWDD services is connecting with a clinic that will provide you with evaluations and then connecting with the CCOs. They will submit the eligibility application for you and provide you with a care coordinator once eligibility is established. So in other words, depending on your situation with your Medicaid, you could receive case management or not. You might need it or not, depending on how much involved or what type of advocacy do you do with your children's needs. And definitely those are the best routes that I can, based on experience, provide. We can provide with information and referral. If you would like to contact us, we can provide with a list of clinics that you can access if you have Medicaid. And if you don't have Medicaid, we can also create a case to provide those step-by-step support so your loved one can receive OPWDD.
Thank you. So next question. Hi, everyone. I would like for you to clarify or point at the programs and services you provided that are just for Manhattan residents, and if there are programs or services that you provide for other boroughs. Thank you.
Yes, that's also for me. So fortunately, our 5 programs under our contract, family support contract, are for Manhattan residents. We can provide non-Medicaid case management, evaluations, educational advocacy, housing advocacy, and family reimbursement to families residing in Manhattan. If you reside in Manhattan, you can reach out to us and we can provide you with information and guidance how to access these services. Now, out of those 5 programs, we only have the contract for 3 of them for the other boroughs. For Bronx, Brooklyn, and Queens, we can provide case management, non-Medicaid case management, family reimbursement, and housing advocacy. So depending on where you live, we can support you with these programs. If we cannot provide you the support that you need, this community, this developmental disability and intellectual disability community and agency providers are connected in a network where we can share other agencies, other places where you can go and get your answers or get the needs met as you require. So please don't hesitate to contact us. Even if we don't provide the service, we will let you know who you can contact in order to get the answers that you're seeking.
Thank you, Joanna. So next question. What programs are provided for children that are 5 and older? So I'll answer this, and if you want to add to it. So we have as I mentioned, the in-person and virtual after-school art program, which serves the 5 boroughs, and that is from ages 3 to 13. And then we have the integrated transition program, which is a hybrid program, and that serves youth ages 14 to 21.
Now, for that, adding to that, Doris, there has been some changes in the service provider or in the service route to OPWDD, where children under 8 are highly encouraged to seek for family support services before they turn 8 and before they receive a care coordination, which is a service for life. And there are many reasons, there are many circumstances that had led to this decision, to this change in the service provision. The first one is that some children under the age of 8 might have a provisional eligibility. That means that whatever symptom they might have in their developmental in their development might disappear or might get better, right? Meaning that after 8, another evaluation might prove that the person has successfully reached that gap or closed that gap between the cognitive and the chronological age, right? Now, another reason is because children under 8 mostly require respite services, family reimbursement can provide that, and other services that can be found in family support programs. That is why a lot of families with children under 8 are finding these closed doors to care coordination organizations because of the age. I would say don't feel discouraged. There are so many services that you can access. Just asking the right questions, focusing in the specific needs can help you to connect with those services.
Thank you. So next question, are your services just for kids and adults with an autism diagnosis or are open to all disabilities? So as far as the Autism Initiative, which is under the Metropolitan Parent Center, we have specific programs like the Integrated Transition Program and the After School Art Program, which does require the child to have a diagnosis or suspicion of autism. But we do have other services, for example, education advocacy, which we serve families with children with all disabilities. I don't know if you
And
want
it's
to
a
add
good,
something.
yes, it's a very good question because the Office for People with Developmental Disability covers a variety of conditions, not just autism. So if your child has cerebral palsy or have any other Down syndrome or any other neurological or condition that affects directly the level of intellect or how independent or functioning can be in the community, that person might qualify for OPWDD services. So under OPWDD, we serve all developmental disability through family support services and through the programs that we have here at Sinergia. So that is a very good question.
Thank you, Joanna. So, next question. I reside in Queens. Who can help me with housing issues?
I will leave that question to Mariam. Mariam, would you like to hop in and answer the family? Although, meanwhile, Mariam connects, um, the first question is if the family has OPWDD. Because as we said in the presentation, housing advocacy services are is a program that is provided to families or people that is already eligible for OPWDD. Other than that, we can provide information and referral. Now, as I said, if we don't have the answer or if we are not the solution to your problem, we know of many agencies or many other programs in the Board of Residents that we can connect you with or we can recommend. So depending on your issue, I will highly recommend you to write us through our website where it says contact us. Write down your information, what is the issue that you're currently experiencing in housing, and we will be happy to go back to you and see if we will be the ones supporting you. If not, we will let you know where or who you can contact.
Thank you. And Joanna, I'm going to switch over to one of our pre-registration questions. How long does it take to apply to OPWDD?
That is a question that I am afraid to answer. In the past, when I applied for my own children, it would take 4 to 6 weeks. Now, the first condition or the first situation is that you have all the documents that are required for the application. If you're missing an evaluation, if you're missing a report, if you're missing an assessment, it's going to bring you back a couple of steps. Eligibility committee will say we need more information, or they might even say we are going to deny based on lack of substantiated evidence that there is a condition. So you will need to then prove again that yes, your loved one has a condition. So depending on how prepared you are for that first submission, that application might take 4 to 6 weeks to be responded. But if you're missing documents, if you're missing assessments that are key in the process, it's going to take longer until all the evidence is presented and until the committee is satisfied to then come with an outcome, if that answers the question.
Thank you. So we have another question in the Q&A. If a child is currently receiving OPWDD services and has self-direction, could this child slash family apply for family reimbursements through Sinergia?
Yes. Yes, we can serve families with self-direction through our family reimbursement program. The only condition is that the family support services or family reimbursement it has been added to the budget, and we will require the copy of the budget as a proof that is part of the services that has been listed. But any family with or without self-direction can apply to family reimbursement. That's the key, that it has been added to the budget.
All righty. This one's more like a comment. I would like to continue learning and to know more about the changes that exist in the New York City system. So I would say, uh, we invite you to visit our website, attend our workshops, to participate in our support group if you're a Spanish speaker. Um, and Joanna, I don't know if you want to add to that.
Yes, I could add, as a mother myself, um, you learn about the system as you get involved in the system. So the more, as Doris says, you can attend workshops, sign up for newsletters, attend the family support, developmental disability council meetings. Every borough has a meeting every month. There are even meetings for different age stages. Like for transition to adulthood, there is a monthly meeting. Uh, find out about what your borough offers through these councils, get involved, be a parent or a caregiver that is very actively involved in the system. That will literally help you to know what changes are as they happen, because they do happen and they happen very fast. So that is my encouragement.
Thank you, Joanna. There's another question. Um, I need to know where my son can receive more therapies, language, occupational, sensorial, etc. He is currently a very picky eater.
No, so that is a very common question for us here serving with OPWDD. The first thing that we guide the families is to know that through the Department of Education, your child is entitled, if there is a demonstrated need, to receive the number of therapies that their child needs, right? So if through the Department of Education you feel that your child needs more therapies, more sessions a week, you can inquire this. You can ask. You can open the IP. You can explore. And if these sessions within the educational let's say, agenda or during the school hours are not enough, then there are agencies that are providing therapies at home, speech, physical, OT, ABA, and these agencies are directly operating under Medicaid coverage. So if your loved one has Medicaid and you are interested in more therapies at home after school, you might qualify for home aid therapies and services at home during afternoon hours. You can also send us a contact message and we can provide you with some examples of these organizations.
Thank you, Joanna. So this is kind of, I guess, a statement and a question. As why does Housing Connect have options to register my children's autism as a disability? Because of this reason, I guess the family were not able to receive the services. I don't know if we can answer that.
Actually, there has been a fight and from our end as agency, as programs, where we have brought up to not just in meetings, but also during audits to OPWDD, uh, that there is a disconnect between the public housing and OPWDD or the developmental disability conditions. How great it will be if in some of these applications I can indicate that I have medically fragile, intellectual disability, developmental disability, or other conditions that makes it just hard for me to find a home, for me to keep a home, or to find a home that has the number of rooms that my family requires. So unfortunately, that disconnect is in the system. We are not getting tired of advocating. We think that eventually this will be a need that will be heard. Um, but again, this is a gap in the system. That's why housing advocacy programs help you navigate the best way possible the public assistance and the housing system within our possibilities.
Thank you, Joanna. So that was our last question. So I'm going to once again share the survey in the chat. Then before you leave, please take a moment to complete that. And after that, I will share our contact information for each specific programs. So if you want to take a screenshot of it, you are more than welcome to do so. And again, thank you to our presenters for taking their time today to share this information with us. It's such an important topic. So thank you. And if you have any questions that you would like to share with our presenters directly, please let me know and we'll get to you via email or contact from your registration. So thank you again. Alrighty, so let me share our contact information. Alrighty. All right, so make sure to take a picture. Please make sure to complete the survey. And once again, thank you for joining us today. Have a great rest of your day. Bye-bye.
Thank you. Have a good afternoon.